right, so COVID-19 has swept across the globe this year, ravaging economies and affecting people's lives. And it's had no small impact on science and the way we appreciate research and knowledge. Well, a public lecture was held today looking at the meaning of science in the age of COVID-19. The lecture, to coincide with the announcements of the Nobel Laureates, was hosted by the National Research Foundation in partnership with the Swedish Embassy in Pretoria. One of the participants is a top South African epidemiologist who is also the co-chair of the South African COVID-19 Ministerial Advisory Committee. That's Professor Salim Abdool Karim. He joins us now. Professor, thank you for being with us, as always. Before we get to today's lecture, there's been quite a shift, I think, in the rhetoric around vaccines in recent days, and I'd love your comment. After saying we must wait, hold on, now the World Health Organization saying a vaccine could be ready by the end of the year. That was this week. Of course, the US president will be delighted. This has come up in debates as the US goes towards elections. Can we finally, in your opinion, start getting excited or relieved?
Very good evening, Francis, and very good evening to all the viewers. Yes, I think, we need to appreciate that there's multiple steps before we can actually have a vaccine rolled out in South Africa. And one of the critical first steps is to show that a vaccine is effective. And we are expecting that at least one of the two frontrunners in the vaccine development field should be announcing their results this year, before the end of the year. But having the announcement of the results does not translate to having a vaccine available, because billions of doses will still need to be manufactured and distributed. Also, one of the frontrunners is producing a vaccine that may not be appropriate for our setting because it requires very substantial cold chain. The vaccine itself has to be kept at minus 80 degrees. Sure. So I think it'll be very much dependent on which vaccine, how it's stored, what's its level of efficacy before we get too excited about it.
All right, thanks. Great explanation. And then today's topic, COVID-19, making science a dinner-time topic. We're all talking about vaccines, about cures. And Professor, we've selected some of the slides that you spoke to. You looked at the good and the bad and the complicated effects. Let's start with the good and the bad. Will you run us through that?
Sure. I think one of the things that has really struck me about COVID in the last 8 months is how science is now no longer something being done by gray-haired gentlemen in the libraries of universities. Everybody has access to data. Data is now freely available, and science is now no longer confined to ivory towers, but people all over are busy analyzing data. They wait for the minister to announce how many cases, how many tests. And, I have my nephew contacting me and saying, they did fewer tests this last 3 days. And I say, just relax, it'll all even out. But they are doing detailed calculations based on strong scientific methodology. I find that empowering. I find that exciting that you can take science and make it in this way. But also, science has now become our greatest protection against all the fake news and the rumor mongers and the conspiracy theories. And that's what I see as a really important role of scientific evidence.
Yeah, but there is still that fake news, conspiracy theories. You talk about snake oil salespeople. Let's just look at hydrochloroquine, touted by the US president. So it's become something of a political issue, whether it works or not. So he's saying new things now that he's been treated. So the science can be manipulated or ignored, and claims become the political football.
Yeah, I think we have been seeing how science can also be abused. And in the case of hydroxychloroquine, really a very poor quality study was undertaken in France. And its results were published in a very reputable journal. The journal subsequently withdrew the article because of the poor quality of its science. But that article recommended the use of hydroxychloroquine. And so the French Minister of Health took on to that. And then eventually the President of the US also promoted the hydroxychloroquine. And the evidence is flimsy. In fact, let's just say it's probably close to non-existent. But what happened thereafter is that science came back to the fore, in that we saw several studies being published in major journals like the New England Journal of Medicine that essentially showed categorically and definitively that hydroxychloroquine has no benefit. In fact, it causes harm potentially in certain individuals. And so one needs to be careful that you don't let a poor science become politically championed when it really does not warrant and does not present adequate evidence for the basis of regarding it as a new treatment.
Yeah. Professor, then you talk about the complications, this whole idea of following the science. Let's look at what it meant in South Africa. We lost freedoms like freedom of movement, freedom to smoke, freedom to drink. The World Health Organization, in some senses, people were concerned that it was calling the shots around the world. Looking back, or if you think we start looking back in 10 years, will there be questions about whether it was all justified?
I think one of the complications, or one of the complicated matters, so I talked about the good, the bad, and the complicated. And I think one of the complicated issues that we have observed in the era of COVID-19 is that science is being put onto a mantle in order to be the basis for decision-making around whether we temporarily suspend certain liberties. And people refer to it as, follow the science. And I think it's because, what's the alternative? Make it as a political decision, make it a scientific decision. But whatever it is, science has been given this new responsibility of becoming the rationale and the basis for really important decisions, and that affect very fundamentally what we do. And my point was that fails to understand and fully appreciate that science is full of uncertainty, that two people looking at the same data may interpret it quite differently. So there's no singular science. There is just the scientific method. We produce data and then we analyze it. In the case of something like a lockdown, I made the point that when decisions were being made or when information was being sought on a lockdown, I did a search on what articles, what evidence is there for lockdown. There are only 3 articles in the entire source of knowledge. Yeah. And none of them address the questions of, when should you put a lockdown? How long should you do it? How strict should it be? There is no evidence for that. So a lot of it is about using your experience, using your knowledge from other diseases. But that has very severe limitations. So my point was that science is about shades of gray. Yeah. There are not many black and white issues, unfortunately.
And we all wanted those black and white answers. I'm sure it was a heavy burden. Everybody wants the doctors to tell them what to do. There is a very interesting graph where you compare, let's bring it up, the low infection rate in Vietnam and South Korea with high infections in the United States and Brazil. Explain there, because there were different approaches and very different outcomes.
Yeah, so when people say, follow the science or, make sure that your decisions are scientifically based, they often use country examples. And I just illustrated that in this particular graph. So what you're looking at is the cumulative number of cases. And when you look at the United States and Brazil, you can see that they are in the millions of cases and that they had a rapidly growing epidemic, and that epidemic continues to grow. With regard to South Korea and Vietnam, they had a very small epidemic, few cases, very few deaths, and they adopted strategies that people would have argued that that's what the scientific evidence suggests. Well, it's not that straightforward, and that was my point. that while we might say that countries are following the science, it's not always evident what the scientific evidence that underpins those decisions. And so we look at countries and we try to emulate them and we try to follow them. And those who are following the science seem to be doing better than those where the leaders are making politically motivated decisions. And so this graph illustrates the difference between those two settings.
All right, Professor, we're running out of time, unfortunately. Let's bring up the final slide that looks at infections in South Africa right now. Can you quickly run us through the measures that you look at, like the doubling rate, which has slowed down incredibly? And are you personally concerned about the possibility of a second wave like what's been seen in Europe at the moment?
Yeah, so when we look at the cases in South Africa, initially, we had an approach where we were going to adopt, government action. And then we were going to pivot that and switch from government-initiated action for prevention to a situation where individuals took that action and tried to implement mask wearing and social distancing. But if we look at the curvature of our graph, that when we had our first case on the 5th of March, we initially, for the first 3 weeks, had a very rapidly growing epidemic. The epidemic was doubling every 2 days. We were on a very similar trajectory to that in the UK. But with the imposition of the state of disaster, which closed our borders, closed schools, prohibited large gatherings, and eventually with the lockdown, that combination of things contributed to a slowing down of the spread of this virus. And so we moved from an epidemic doubling every 2 days to one that's doubling every 15 days. And so slowing it down bought us time. Didn't avoid us having the epidemic. We had quite a severe epidemic, over 600,000 cases. But it bought us time so that by the time we hit our peak, we had field hospitals in place, we had oxygen supplies that were adequate, we had new therapies like dexamethasone. So all of that contributed. And now we've overcome the first wave and we are now at the trough. The issue is that we are now going to determine through our own behavior whether we are going to see a second wave. We know that about half of all the countries that have had a first wave have had a second wave. So there's a good chance that we will have a second wave. But if we take our prevention seriously and follow the rules, there should be no reason why we will have a second wave or that it would be a particularly severe one.
Yeah, you do say the science, supports those basic things still, like wearing a mask, sanitizing. We have to leave it there, but thank you so much, Co-Chair of the SA COVID-19 Ministerial Advisory Committee, Professor Salim Abdool Karim.